Come on, darling. Doggy, look. He's a good boy. He's a good boy. He's suffering. Yeah, he's got pain in his right leg. So straight to the vet today. I don't like seeing him walking around lame and not himself.
At Bondi Referral Hospital SASH, 8-month-old boxer Dougie has limped in with owner Louise and her daughter Leah.
Yeah, I'm Andrew, yeah.
How you going?
Hi. Louise,
I'm Louise, yeah.
Nice to meet you. This is Doug.
This is Doug
Hey,
with a
Doug.
sore right leg.
Oh, Doug, what's up? What's up?
Specialist surgeon Andrew Marchevsky needs to see Dougie walk so he can trace the source of the pup's pain.
Oh, dear. All right.
Come on, Doug.
Come on, Doug.
Let's go.
Come on.
Come on, pop, 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 pop.
But every step is a struggle.
Come on, Doug.
Come on, Doug. You're one of those people. Here, I'll go
Come
behind
on.
you.
Yeah, come on, mate.
Come on.
Come on, Dougie.
He says, I'm
on,
quite
darling.
unwilling. He's got a funny, waddly sort of front limb gait. He's not really that lame, but he's quite stiff. What was the first thing you noticed that wasn't quite right?
I've got another dog, a Mastiff Great Dane, and they play. And Dougie was up and he's landed down and yelped.
Okay.
So, and then he was a little bit lame, but then in the afternoon he jumped off my bed
No.
and couldn't walk on it
Okay.
anymore. So,
And so it's the
hurt.
right one that
Yeah.
you've noticed as a problem?
Yes, yeah.
Come here, Doug. Come on. You can just a little bit of swelling there. You shouldn't see that bulge at all. It should be sort of scalloped out the other way.
Yeah.
You all right, big fella? Eh?
It's worse than first thought. Andrew discovers a problem with Dougie's left leg as well.
You can see that this is his good one, inverted commas, but you can see that little lump there.
Yeah,
That's just increased joint fluid.
from favouring it
Well, no, he's got a problem in that one as well.
as well, yeah.
His feet are very flat.
Yeah, they stick out.
Like that?
Yeah, is that normal?
No, but I guess for him, it's how it's most comfortable for him to walk. So he's walking like that because of what's going on in the elbows. Dougie's had some x-rays taken already, and there is an obvious problem in both of his elbows. I guess what I'm concerned about is, whilst that's really obvious, is there anything else going on? So this is part of this is his elbow joint.
Yeah.
And this is the ulnar bone. And see this process here? That's called the anconeal process. And on these x-rays, it's not joined on here.
Oh, okay.
So when they're born, it's not joined, but once they get to about 4 months of age, it heals and fuses, and his hasn't done that.
The fear is that without treatment, the young pup's condition will become crippling.
I think we need to CT, because it's a much more accurate representation of what's going on.
All right, okay. My God.
Hey Timmy, what's up? And you need me up there now? All right. I'll see you soon.
Chris is responding to a call for help from Australian Reptile Park Operations Manager Tim Faulkner. He's concerned about one of his kangaroos.
There's no doubt Tim's pretty good when it comes to his animals, so for him to be worried enough to call me in, you know, this must be pretty serious. Timmy,
G'day, mate.
how are you, buddy?
Good, how about you?
All right. Always get nervous when you want to meet me off exhibit,
You'll be right.
when the general public can't save me here.
Yeah.
So what's going on?
Well, we've got Mum up there. It's the female on the right.
Yeah.
And she's just behaving a bit abnormal. She's licking around her mouth and I can see something on her face. All that's there at the minute is just a small lump under the chin.
Kangaroo,
Yeah.
a lump
Yeah,
on
I
the
know.
chin.
Yeah.
Yeah, so I mean, you know what I'm worried about.
Yeah. Well, lumpy.
Yeah, lumpy jaw. The moment Tim tells me he's seen a lump on the jaw of this kangaroo, my heart sinks. Because so often that means one thing, lumpy jaw. Is it big at the moment?
No, so maybe 3 weeks ago we noticed something that was the size of a marble.
Yeah.
And in the last few days or week, it has got a little bit bigger. It's still small, but the chin's normally flat and we've got a definite lump there. So that's been the giveaways and enough for us to react.
Yeah. Lumpy jaw is a disease that's really common in kangaroos. It's caused by a bacteria they pick up off the ground, and it causes a nasty infection in the bone of the jaw. From there it grows, and it can be incredibly hard to treat. Has she got a bub there?
Yeah, she's got a big bub. That's our worry, is that she's a bit drained from that big baby, and you know, something's wrong with her, and that we need her to rear that joey.
Yeah.
Lumpy jaw is what I was worried about, because it's an infection in the bone, and bone doesn't have much blood flow, the antibiotics can't get in there. It's worst case scenario.
My hope is it's going to be something like an abscess,
Yes,
but we're only really going to know once we get her
Yeah.
and actually feel it.
and have a look.
If you don't get onto lumpy jaw quickly, sadly, it can be fatal. And for a young mum who's currently juggling a joey, it's something we just don't want to think about.
In Sydney's north, there's been a spate of paralysis ticks attacking pets.
Hello, how are you? Hi. Bill, come on, darling. That's a girl.
Carla has rushed into SASH with 6-year-old Bella.
She's been licking her lips a lot, and she's usually very bossy and outgoing, but she's been quite submissive. So I brought her in for you to have a look.
Okay.
Sure.
Have a look at her ASAP.
No problem. Yep. Come on,
darling.
Baba.
2 other dogs are already being treated in the hospital's intensive care unit, fighting for their lives after tick bites.
Hi.
Hey, what's going on?
Mummy came home and she thinks I've had a little tick above my left eye, but she's not sure.
Emergency vet Dr. Lisa Chimes could now be dealing with a 3rd tick bite victim.
All right, let me just have a look. We're right in the middle of tick season, so every second case that I'm seeing is a patient with a tick. We've got 2 patients on ventilators because their tick paralysis has got so bad that it's paralysed their breathing muscles. Bella's come in here because she's got a swelling around her eye. Her owner left her home this morning. She's come back home and now the eye has suddenly swelled up. Her little heart is racing. So far she's breathing normally, but that could change quickly. She doesn't know what's going on. Bella's in a bit of distress and she needs it sorted out.
If she does have a tick, Lisa needs to find it, identify it and take action before Bella goes downhill.
Oh, you are terrified, honey. Really shaking. It's okay.
Lumpy jaw, it's a hard one to treat.
Yeah, we've had a few cases of it, and it's, well, that's why we're a bit reactive now, and the lump now is seemingly small, but over the last few weeks it's got bigger, so that's why you're here.
Yeah.
Tim's called Chris to the Australian Reptile Park to examine Matilda. The mother kangaroo has developed a swelling on her jaw, and Tim is worried it may be a fatal condition called lumpy jaw.
Now, Timmy, obviously we need to look at this.
Yep.
We're talking about a grey kangaroo here, though.
Yep.
How are we going to catch that?
Well, we're not going to catch it. You're going to catch it. You don't have uniform on, so this uniform, unfortunately, if any of the roos are sick, I have to catch them. They're used to me giving them injections, and I won't get close. So you're going to be the tourist and grab on.
The plan of action is a little bit unique. Essentially, I'm going to try to act like a tourist. Walk up to her, offer her some food. She's going to hopefully take it, and from there, to reach for the tail and get it before she hops away.
There you go, mate. 1 bag of kangaroo food. Okay, so I might hang back next to the shed.
Yeah.
And you head up and see how you go.
Getting close to a sick kangaroo which is protecting a joey will not be easy. And there's also an added pressure.
Chris catching the kangaroo on the first go is critical. If he misses, we will not get a second chance.
I'll just give this one some food first. Here we go.
Try and get a bit side onto her if you can. Chris is doing well. He's got the trust of the kangaroo. He's feeding her. He's given her a pat. But now comes the moment of truth. He has to slide that hand down her back and grab onto the tail. And from that point on, he has to be committed. Go for it. That's it, mate. 2 hands. Hold it. Got it. Beautiful. Nice one, mate. Whoa, right in the back.
If you look at it, he's not been put together great. Pretty much all I can see is those what we call ununited ankylosing processes. Big word, but basically it means there's a bit of bone in his elbow that is in two pieces rather than one.
At SASH, Andrew is giving Dougie a CT scan to find clues to the young boxer's crippling leg pain. There's arthritis in the joint. If left untreated, Dougie faces a life of pain.
Nature intended for those bits of bone to be together, so that's what we've got to do is make them together. So we'll have to drive a screw across those two bits of bone and sort of just squish them together and get them to heal.
Devoted owner Louise is anxiously waiting for Andrew's diagnosis.
Dougie was the youngest, the runt of the family. There was 13 puppies born. And when I looked at him with all the puppies running around, he just attracted me straight away.
Come on, Doug, here we go. Look, they're around there.
Andrew has to break the news to Louise and daughter Leah that Dougie's problem is twice as bad as she initially feared.
Unfortunately on CT, even though he's obviously worse on the right, when you look at him, if you were to look at the CT, you'd be going, oh, I'm not sure which is worse. To put it in perspective, I think if only one leg was affected, he'd be really lame. But because both are affected, he's sort of going, oh, well, this one's a bit worse, so I'll limp around on that one a bit more.
Okay.
There you go.
I just want to get the pain and all that fixed.
If we don't try and do something now, he's going to be in pain from now for a long time. And I don't think his life's going to be much fun, and I don't think it's going to be that long.
There's a tick outbreak in Sydney's north.
All right, let's take a look and see what that actually is.
At SASH, Lisa is urgently trying to work out if Bella has been bitten by a deadly paralysis tick.
Good girl.
Bella has previously been a tick victim. Last time she was in hospital for 3 days.
Oh, that looks like a tick. Ticks can be life-threatening for dogs. They have a poison in their saliva that actually paralyses them. So a dog can come in seeming okay, and within a matter of hours they can be paralysed, unable to walk. Worst case situation, it can paralyse their breathing muscles and they end up on a ventilator. So it's pretty serious. Oh, its legs are wriggling and oh, they're revolting. Looking really closely at Bella's eye, I can actually see the legs moving. This tick is alive. All right, the trick is how we're going to get this out in such a fiddly spot, huh, Missy Moo? Good girl.
It's a delicate operation. If the tick digs in, it might secrete more deadly poison.
Oh, it's really
Hey! Good girl.
Now, we actually have to work out what kind of tick it is. There's lots of different ticks in Australia, and we need to make sure that this isn't a paralysis tick, because if it is, Bella could be in serious trouble.
That's it, mate, 2 hands.
At the Australian Reptile Park, Chris and Tim are struggling to capture and calm a frightened Roo.
Nice one, mate. Oh, right in the back.
Matilda has a swelling on her jaw and needs an urgent examination.
Can you grab the bottom legs? That's it, and lift her over. Okay. That's it, mate. Got her. Nice one.
She obviously didn't like the blue shirt.
Yep. No. So the shirt's gone.
Jeans are gone.
Fingers are bloodied.
Yep.
With Matilda now under control, Chris must remove Walt, her little Joey, from the pouch.
It's all right.
But Mum isn't happy.
That's all right. It can be hard dealing with a mother and her young. What we don't want is for the baby to jump out and take off. Now, Chris's job is to slip it straight into an artificial pouch, keep them close together so that they're comforting each other. It needs to go well. You can see that lump.
Now Chris can begin an examination of her jaw.
It's a bit bigger than I thought. What do you think?
The worrying thing for me here is that that lump's firm. You know, if I wasn't concerned before, concerned now. With these, I always find you've got to act quickly.
Yes.
So I think the most important thing is to, first of all, let's relax her.
Yep.
Let's give her an injection of something.
Okay.
But we need to get her to a vet clinic.
Yep.
And actually have an X-ray of this.
Okay, sure.
And then from there, work out what we can do.
Okay. No
Let's
worries.
hope we can do something.
Yep.
The prognosis doesn't look good. Matilda has all the telltale signs of the potentially fatal lumpy jaw.
Settle down. Settle down. That's it, settle down.
Okay. Yeah, she's asleep now.
Happy?
Yeah.
I'm gonna jump off.
Yep. Now that we've got her under control, she's been given her sedation, it's time to get her to the vet clinic.
You right?
Yeah.
Tim knows just how serious this disease is, but he's trying to stay positive.
I mean, it could be a fatty tissue lump. That would be good because it's very treatable. But lumpy jaw is its worst case scenario.
She's done some of these. Jade's done some of them.
At SASH, Andrew is operating on brave 8-month-old Dougie. The boxer pup has chronic pain in both his front legs.
This surgery is going to take us a while, having to do both legs, but the end game again is that we'll get him so he can have a good fun life. So that's the needle there. Just flex him a little. So we're in here basically now to do 3 things. We've got to fix his left and right elbow, plus take a little fragment of bone out of his right elbow as well. Oh, you can just see it there.
Andrew has already detected signs of arthritis in the young dog. He's hoping surgery to repair the badly formed bones will halt its progress.
Look, I mean, ultimately, we know Dougie's going to have a little bit of arthritis, but we want to keep it to a little bit of arthritis. Could someone grab me another 21 gauge needle, please? This is all the joint fluid, all that there. Normally a dog should have maybe 1/2 to 3/4 ml of joint fluid in an elbow joint, and I've just taken out 6 without even trying. So his elbow's in a bit of trouble.
With the excess fluid removed, Andrew can now see the full extent of Dougie's problem.
That needle is actually pointing to the fragment of bone that we've got to reattach a little bit later. There, so that's the bit of bone that hasn't fused that should have, and we can just touching it lightly with the needle that we've got in there, and it's just floating around just free. So that's as bad as they come. Poor Doug. Poor Doug.
I reckon that is a paralysis tick. Yeah.
Lisa has discovered the tick she removed from Bella is a potentially deadly species.
This is actually not such a great outcome for Bella because it means that she could have that paralysis tick toxin in her system. I now need to have a look at her from head to toe to make sure she hasn't got any subtle signs of paralysis. Okay, so I'm just going to give her an antihistamine because she's had a bit of a local reaction to that tick being there. Little eye swollen. Hey, Bobby, a little sting, but it's definitely not going to feel like that tick felt. That's the way. Oh, good girl. Hey.
Brave ones.
Good girl.
You're a lucky girl.
Goes to show how important it is to check your pet every day.
Regularly.
While we're here,
Yeah.
let's just do a little check. I'm just going to make sure that there's no other ones. I didn't see any.
You're so
Bobby, you're a
nervous.
nice one.
Hey, good luck.
Ticks really can hide anywhere. Most of them like the head and the neck, but they can hide in any crevice of the body. So we've got to search it from head to toe, making sure that there aren't any others, because the most important thing is to remove the tick early before it causes any symptoms.
Lisa gives Bella a final tick guard treatment for added protection from the toxic parasites.
You like that?
Ew, it's a nice little rub down, huh? You're getting the full works. Just a bit stinky.
Agreed.
Look at you. Bella is really lucky that her mum brought her in when she did because we were able to get that tick out before it caused any paralysis in Bella. If she'd waited a few days, even a week, Bella could end up on a ventilator. Your mum's going to be very happy to see you. You're a lucky girl. The message here with ticks is that we need to pick them up early, and Bella and her mum are a perfect example of that. You can remove that tick before they've had time to feed on your pet, then the chances of them becoming paralysed are really small. So she's had her treatment, tick's gone.
Great.
She's feeling good.
Well, thank you so much.
My pleasure. And 24 hours a day you can give us a call. Okay,
Okay.
take care. The fact that we can get Bella out the door with nothing more than a little crater above her eye, that's a happy ending.
Look at that sort of fibrillation there. Ooh, that right up there doesn't look healthy, does it? And we've found the abnormal bit of bone that we were looking for.
In SASH's operating theatre, Andrew is performing marathon surgery on both of Dougie's disabled front legs.
Basically, we've removed a little bit of bone that was on the right elbow, so we're sort of now about a third of the way through what we've got to do.
The pup's young bones haven't fused properly, so Andrew is trying to insert screws to hold them together.
Look at that. An unhappy joint. The hard bit is getting the screw in exactly the right spot because this fragment's not very big and it's not that substantial. So my big fear is it's going to crumble when we try and do this. I'm just going to, you know, that's just abraded. You know, this is definitely a case of it's too tight. Look at that. Doug, you're in trouble. We're finished putting the screws in both of his elbow joints now. We're just now going to make a little cut in one of his bones, the ulnar, which will help release the top half of that and take the pressure off the screw that we've put in and give it the best chance of healing.
If this repair doesn't work, the young boxer will lose the fight for a pain-free future.
In theory, that should stop it moving too much. All right. We've got screws in both sides. So we've done the best we can to give Dougie the best chance he has of being able to run around and be a normal dog.
Chris and Tim have brought Matilda and her Joey Walt to the Green Cross Vet Clinic, 5 minutes from the Australian Reptile Park.
Just straight through to X-ray would be good if we can.
An X-ray will confirm whether the growth in her mouth is the potentially fatal lumpy jaw.
Okay, ready to go. 3, 2, 1. X-ray. We've got a problem in the right side of that jaw.
Yeah.
All this area underneath
Yeah.
shouldn't be there.
So that shaded area, that's actually bone.
So it's actually the lumpy jaw. So new bone's being produced around there
Yes.
to try to almost form a capsule around this infection.
Yeah.
The body knows it's not meant to be there and it's trying to get rid of it by wrapping it up in bone and that's what we're getting here.
This diagnosis is the worst possible outcome.
The X-rays really confirm what we suspected in the kangaroo pen. That's the fact that Matilda does have lumpy jaw.
Now that's not what I wanted to hear. I mean, lumpy jaw, it's a problem, and even as small as it is now, the reality is it's going to get bigger.
Matilda now needs urgent life-saving surgery.
The strategy is pretty simple. Make a nice incision over the top of that lump, work my way down onto the bone, scoop out the infected bone, and really if we do that well, we're a great chance of limiting any spread of this infection.
Chris needs to work fast. Every minute under anaesthetic greatly increases the risk to the kangaroo.
Feeling the pressure of you guys, but it's Walt's eyes that are currently burning a hole in me.
Yeah. He's happy. He's in his little bag.
Just in the raised area of bone now, it's quite inflamed, so we're getting a bit of blood coming through. It's almost like these bacteria don't want to be found. So they hide away in this jawbone here and deep. And so you've got to sort of uncover them in their little lair by scraping away until you get in there and really scooping them out. All right, I've done just about enough scraping there. Now that the base of the jaw feels flush with the rest of the bone, I'm pretty confident we've got enough tissue out. So it's time to close it up. All right, that's the last stitch there. So, we're done.
Okay.
I think the best plan now is that we move quickly, get her off the gas, back into a box.
Yep. Hopefully this increases her chances of survival. I mean, lumpy jaw, it's a problem. If this gives her a chance, then it's a good thing.
Fortunately, we've managed to get Matilda through today safely so far. The key now is getting her back to the park before she wakes up. One, two, three. Go slow. We're good? Good to drop.
At the Australian Reptile Park, Chris and Tim are keeping a close watch on Matilda as she wakes up from life-saving jaw surgery.
As we saw a few hours ago, kangaroos can be quite flighty. So when they come out of anaesthetic, it's a really risky time.
Even after we've done so much, you just can't celebrate until she is totally awake, sitting up and looking alive. There we go. Ah.
Okay, girl, you're fine. Let you take your time. That's all you can ask for, mate.
That's good, hey?
Yeah, it's great. All right, no rush, no rush. There we go. For her to be awake and happy to just gently take her time, it's very good. Now, Matilda, there is one thing we still owe you.
When Chris reunited Matilda and little Walt, it was pretty moving because little Walt knew exactly where he was, he knew what to do, and as he moved around the side of Matilda, they just touched noses and had a bit of a smell and a kiss, and then he moves around and jumps straight back in the pouch.
Home sweet home.
I'm sure that was comforting for him, and I'm sure it was comforting for Matilda.
Now, hopefully what we've done for her today makes the rest of her life easy.
Yep. I'm really happy that Chris has come up. I mean, it's unfortunate that Matilda has lumpy jaw. Hopefully, what's been done today has fixed that, and she lives a long and happy life.
What's the matter?
There's a doggy boy.
You gonna come out? We'll see how you're going. Come on. Yeah.
Oh, you look so good.
Come on. Good boy.
Come on, boy.
You're gonna come out? What can you do? Come on. I know it's a bit sore, isn't it? Come on.
3 days ago, Andrew operated to repair the bones in both of Dougie's painful front legs because they hadn't fused properly.
Can I have a look at this one? I know. You're gonna lay down. There you go. Oh,
You're going to lay down. Oh, you want a tummy rub?
Look, there's no doubt, having done surgeries on both of his legs, he's going to get worse before he gets better. Bit swollen, isn't it?
Ouch.
Yeah. Now, we've cut through bone and screwed bone, so he's definitely going to be feeling it today. Come on, hey, that's how you're going. Oh, you're a bit hop-alongy, aren't you? I know. It's a bit tough doing it on both, isn't it? Yeah, you got a bit of get up and go there.
I just Steve.
Yeah, look at that. Go, Doug. I must admit, I was a bit worried about Dougie after surgery because I think he's a bit of a wuss, and I thought he was just going to lie around and say, I'm broken. But he's actually surprised me. He's getting up and around pretty well, so he has hidden strength. Come here, good boy.
Go, Dougie.
There you go, good boy. Oh, that's all right, isn't it? But he's doing so well, I'm actually going to get him home a bit early. Doug, we're going home. Come on, mate. Louise is here. Your mum's here. Come on, Doug.
I hope he's excited. I hope Dougie's missed me. I hope he hasn't forgotten me. Hello, Dougie. Hello, Dougie. Oh, it's excellent. To know that he's going to run around normally without pain, it's wonderful.
All right. Come on, Doug. We have to go now. Out. You can't stay here forever. Come on.
Come on, Doug.
Dougie's enjoying the attention, but he's still a bit unsure on his new improved legs.
It's not his favourite thing in the world, getting up out of lying down. He likes lying down. Come on, Dougie. Come on. You head for the door. I reckon he'll go.
Come on, go in the car.
If we'd have done nothing with Dougie, he'd have been a lazy, lay-around sort of dog. Not because he was lazy, but just because he was in pain and he wouldn't want to do anything. With the surgeries we've done, he'll get to a point where he can run around, be a crazy, happy dog, and that's a great result.
Thank you very much. Come on, Doug. Slowly. Hooray.
Good girl.
A courageous little girl called Olivia and her mother Fiona have just arrived at the Bondi Clinic with pet cavoodle Daisy.
This way. Come on. Good girl, Daisy. Hi, how are you?
Good, thank you.
Daisy's here to see Dr. Chris
Great.
today.
Would you like to pop Daisy into the waiting room? Just
Yeah, sure. Thank you. Daisy is an 8-month-old cavoodle puppy. Olivia expressed to her father and I how much she'd love to have a puppy of her own and informed us that she had saved up enough money to buy a dog. Good girl. 5.4, Olivia.
I chose the cavoodle because it was a small dog just like me and it's a good brand.
Daisy is much more than a family pet. Both Olivia and her mum have a rare condition called osteogenesis imperfecta, or brittle bones.
Olivia had plaster on for about 9 months this year and spent a lot of that time in a wheelchair. It is difficult as a parent to see your child in hospital. She goes there every 2 months to have infusions to help her strengthen her bones, and you know, for a little girl to come home at the end of the day and know that she's got her little best furry friend waiting for her, it's a comforting thought for her. So Daisy's played an integral role in helping Olivia, you know, get back to being a kid and having fun.
Yes, I think about a lot of Daisy when I'm in hospital because she makes my day shine.
But today, it's Daisy who's the patient.
Hello there, guys. How are you?
Hi, Chris. How you going?
Ready?
Okay.
Come on through.
Come on, Olivia. Give me a hand. Good girl. This way. Come on.
Come on through.
Thanks, Chris.
It's okay. All right, hey, Daisy. How are you? All right, so what's been going on?
Yeah, Chris, we bought Daisy today because she's 8 months old, but the puppy teeth in the upper have not come out at all. But the adult teeth have come down.
Yeah.
But I think they're annoying her because she's starting to drag her face along the ground.
Yeah, okay.
You want to show Dr. Chris where it is, darling?
There's that one.
That one there, yeah.
Yeah, and on this side it is that one.
Yeah. So you're certainly right. I mean, at 8 months of age, she shouldn't have those teeth there. Daisy's got a fairly unique condition where her fang teeth that normally fall out at around 6 months of age have stayed there. We need to make a decision about what we do with these teeth. If these teeth do hang around, they can trap bacteria and they can be a source of infection for years to come. Has she been desexed?
She has.
She has?
Yeah.
Okay. Normally what we can do is when she comes in to be desexed, when she's under the anaesthetic, we then remove those teeth.
Yep.
So we obviously don't have that opportunity.
I hope she doesn't have to go into surgery because I have had a lot of surgery myself, so I don't want her to have surgery.
With a brittle bone syndrome, Olivia has had 7 years of various bone strengthening operations and treatments. She saved her pocket money for 3 years to buy Daisy, and she's her constant companion.
Even though Daisy's a puppy, she understands, I think, that Olivia has got special needs and she just sticks by Olivia's side. Because we wouldn't want Daisy to get sick, would we? That wouldn't be very good.
Once she ate poo and then she vomited.
Did she?
She ate poo.
Are you serious?
Yes.
Wow. Strange, huh? They all do it at some stage. Who wears more pink, you or her?
Probably me.
Probably you. Is that the rule? She can't wear more pink than you? Okay. Let's have a look over the rest of her first.
Okay.
And then we'll come back to the teeth, okay?
All right.
Okay. Have you ever heard of her heart? No? Okay. I'll just put these in here.
Did you tell Dr. Chris what you want to be when you grow up, Olivia?
A vet.
Do you really? Oh, well, this is your first patient then.
I want to be a vet when I grow up because I want to be like Dr. Chris, fixing animals and I like fixing animals. And sometimes I bring Daisy out with a bandage on her leg.
Now, can you hear something there?
No.
No.
I hope you can hear a heart, Olivia.
Yeah, it's right.
I can hear something going beep, beep, beep.
Yeah, that's it. Have you listened to many hearts? Is that how you'd imagine a heart should sound? Yeah, and it is. The heart sounds good. Okay. So tick. Well done. All right, so that means we can focus just on her mouth.
Yep.
And on those teeth. What I'm conscious of is that I don't want to put Daisy through an operation that she doesn't need right now. What I would like to do is give her another month or two.
Okay.
And just see if those teeth actually loosen up a little bit.
Right.
Then I might even just be able to pull them out.
Right.
Or you can attach some string to them and yank them out yourself.
I think Dr. Chris made a fantastic suggestion that I get to take Daisy home.
How about, while we're waiting to see if these teeth become a bit loose, I'm going to give you some homework. You need to find out if there's a dog tooth fairy. Okay? So that's your project.
I think if I get a bit more, if she loses both at the same time.
Okay, good thinking. You reckon they do a special deal for two? I don't think too many kids would spend 3 years saving every single cent they have to buy a dog. But Daisy's no ordinary dog, and certainly Livia's no ordinary girl.
Okay, thanks, Chris. We'll be in touch.
It's great for kids to be able to grow up around pets, but when you see the fact that Olivia has put so much of her heart and soul into having Daisy around, you see this connection. You understand just what the two of them go through together, and you can't help but feel touched by this bond. And really it makes you want to make sure that everything works out just fine for Daisy.
It's been 6 weeks since Chris performed life-saving surgery on Matilda.
All right, that's the last stitch there. So, we're done.
Okay.
The kangaroo had lumpy jaw, a potentially fatal disease which was growing in the bones of her mouth. But now she's fully recovered and living happily with her Joey Walt at the Australian Reptile Park.
Look at Matilda and Walt. She's 100%, and it's another one of those times when I just feel good about calling Chris, because if he didn't do such a great job, she might not be here. For me, this was a perfect outcome.